the drain. You are using alcohol swabs anytime you get near the drain port. Overall, you have your drains for anywhere from 24 to 72 hours, and then you're done. Nobody likes drains, but they do serve a purpose. And while there is drain-free options for explant, you should know the pros and cons of each. Drain-free explant, generally, there is a drainage pathway that is created using cannulas. So whenever you're disturbing the fascia, you run the risk of prolonged swelling, lymphatic disturbances. The other issue that you can have is you can get an accumulation of fluid, especially if the compression is not tight enough. When you have an encapsulation of fluid, you have an area that could harbor bacteria. If you have an area that has bacteria, you may start experiencing some symptoms of inflammation. Does this happen every single time? Absolutely not. What is the drawback to doing an explant with drains? Infection. Why? Because once you leave the OR, you are no longer in a sterile environment. People pet their dogs, they put on an old t-shirt, something where there was bacteria, and it gets near the drain port and you develop an infection. So there are ways to, of course, reduce that risk by making sure that you are washing your hands thoroughly and that you are using alcohol swabs anytime you get near the drain port. Overall, you have your drains for anywhere from 24 to 72 hours, and